The traditional dentist has been a repairman. And in the bottom belly of us, we call them tooth mechanics. I don't think there's any dentist that enjoys being a tooth mechanic or a hygienist that believes in being a gum scraper. You know, they don't, this is not a job that we aspire to. We're educated to think differently in the beginning, for 2 years of medical education and 2 years of surgical preparation. After a 4-year journey through the sciences, in my case, it was biochemistry and physics. Fabulous journey. But when I left that experience and I entered a residency for a year, what I learned was they had prepared me to be a surgeon. They took away my medical orientation. They made me a surgeon, not a physician. Now I see myself as a much better clinician who's actually a physician. And the surgery part I enjoy. I wished I could do less of it, but I do enough of it to earn a living. I will say in the end, the physician of the future, the dentist of the future, needs to be a physician. He needs to see the person whole. He needs to understand the importance of what goes in this mouth affects the whole body. And that milling machine that we correct and those supportive tissues that are other than the teeth, including the taste buds, they need to be in good harmony. And we have an opportunity to measure inside the mouth systemic conditions, like the pH of the saliva is a good indication of what the systemic condition of the human that we're treating is. And if, as a biochemist, I was taught there's 3 things you must do when you are conducting an experiment in biochemistry. You have to control the pH and the temperature and the dilution of the reagents. So a well-hydrated human being at the normal body temperature working at a pH in the 7.2 to 7.6 range is going to have the most consistent chemical reactions within their body that produces the most energy and the least toxins. That's what we're built to handle biochemically. There's 4,900 plus chemicals that are now allowed to be put by the FDA into our foods. God bless if we could eliminate 2/3 of those. Some of them we may not be able to eliminate, but the other 2/3, the colorings, the artificial flavorings, the hardcore preservatives that allow things to last for months need to be eliminated. That's why you need to make good choices. That's why when you eat on the periphery of the grocery store, you end up with a correct pH. You've got to hydrate cleanly all the time without the stuff that comes in bottles that are artificially flavored and manipulated. Water is what we're geared to drink. And I think now that I know that, when I practice, I speak that to my patients. That's what I say to them. You got to think differently about what you put in here. This is a treasure trove. I also now believe that the mouth's a very sensuous place. I have a whole new respect for this whole part of the face. Eyes, ears, nose, mouth, all these senses, 4 critical senses right next to each other. How is that? And smell is an important component to taste. And so I now look at the body wholly, and I look at the place that I'm empowered to treat as an invitation to make people healthy. So I've morphed over my career.